Rise, shine on. I was made to show. Shine on like the sunrise breaking through. No more dreaming in the dark. I'm waking up my heart. This is where I prove it. I'll be loved. Shine on. Good morning. Shine on. It's Ashley Tarter here with my friend Leslie Morton, who is a physical therapy assistant. Good morning, Leslie.
Good morning, Ashley.
I just wanted to start the podcast by thanking you for dropping in with us today and remind everyone who's listening to like and subscribe and share this podcast with your friends. Maybe you have a friend who is looking for some ideas of where they want to go after they're done homeschooling, or you have a friend who has already done that and been really brave to launch out into a new career, and you'd love for them to be interviewed, or maybe that's you. And so I just there's a link tree. It's linktree/shineon.ashley, and we want to just invite you to fill out. There's a Google form there that you can fill out for considering people for interviews. And then you can connect with any of the people who I've interviewed through that same link tree. So this morning we're talking to Leslie, who has become a physical therapy assistant after her homeschooling journey. So, good morning, Leslie. Tell us what you did first before kids, before you were a physical therapy assistant.
Yeah, so I went to school originally as a elementary education teacher, and I did that for about 6 years. And I had married a Army guy, and so when I had kids, I stayed at home with him. And of course, we were military and traveled and were in multiple duty stations. Enjoyed my teaching in the classroom, and then wanted to stay home with my kids when they were born, and the military life also really made that much more easier and kind of necessary in many ways. And then when they were about, I think my oldest was in second grade, I decided to homeschool. And so I homeschooled my oldest from second to eighth grade. And then my other ones, I have three children. I have a 20, soon to be 23-year-old, a 20-year-old, and a 16-year-old.
Nice. Okay. And so as they were growing up and moving on to become more independent, then that's when you started looking for a career to support your family, right?
Yes, did. Unfortunately, in the process, I ended up getting divorced, and so there was also a financial necessity to do that. But so we had been homeschooling, and when I was starting to look at a way to help support my family, I really just decided. I was kind of looking at my options. I had still had my teaching degree, so I had that as a possibility. I did end up kind of helping in a classroom in a private school for like a year. But I ultimately just decided, for financial reasons and just wanting to do something different, I found myself just thinking of a defaulting to teaching, and that is definitely not a career I would ever want to default to. So I ended up. I was actually talking to a good friend, and we were just kind of tossing around things that I might do, and possible things I was interested in. When I was in high school and college, I had, was ran track, and I was involved in sports, and so I was often in and out of training rooms and would occasionally get injured, so I'd have to get some assistance there. I had myself had PT before, and it was just one of those things that I still like. I enjoyed the helping others and connecting with kids. I really enjoyed the classroom element of teaching and just kind of getting to know children and their stories and helping them solve problems and become more confident and in their own skill set and what they needed to learn. And so I kind of was looking at different things and saw started a friend said, "Have you ever considered physical therapy?" And at the time, I was 48, and so it was kind of like, well, do I go? What are my options in physical therapy? And there, a PTA is a 2-year program, and a physical therapist is, nowadays you need a doctorate. It used to be that you could just do a master's, but now you need a doctorate. And so it was really a matter of at the time just looking at, how much debt do I want to accrue, or if any. And with the physical therapy assistant program, I was able to make the living that would be enough to support my family. And yet it was only 2-year program.
That's great. And how much does a physical therapy assistant program tend to cost?
So they're around, let's see, I think I ended up paying probably about $24,000 um, for I'm trying to think, it was about 6,000 a semester, I think. Um, and then, yeah, and so it was about 4 semesters. Yeah.
And are the semesters like full time, or was it you were also balancing like a side job, or you're still homeschooling while you're doing the semesters?
So when I started, it is full time. At least the program I did. Now, the program I did was through Riverside Health Careers. So I worked for Riverside, and
Through a hospital.
yes, and so
Hmm.
there are multiple. I mean, there are programs that are linked to hospitals, and then there are programs that are just on their own in a technical school. Um, that so like ECPI locally has their own school, but they're not linked to a particular hospital program.
Do you think there's an advantage? Do you think there's an advantage of one over the other?
Well, yes, in some ways, yes. The hospital linked programs often have, like, for instance, Riverside has tuition assistance. So if you get hired by Riverside, they will pay back some of your loans or
Oh,
give
nice.
you some money to go towards some of your loans. Um, and they have it's like a feeder program. So often they will your first choice hires are Riverside students. So I think you get a
So you
little
get
bit
an
more
advantage.
exposure. Yeah,
Yeah. Yeah. And it
yeah,
seems
because
like physical therapy is, a growing segment in the economy, and more people are needing it and being funneled to it. And so it seems like, in general, the healthcare system needs more physical therapists.
yes, that is still a growing. It's a pretty stable career path. I think on both sides, physical therapists and PTAs. I will say, I mean, there's other routes like CODAs or occupational therapists, and I do see a downtrend some in occupational therapy as far as OTAs go. There's just not as we just you don't see as many, and there's not as many hires for them. So, but yeah, but across the board, it's real easy to kind of pick up a job anywhere, travel with it. Um, and there's many different, you can either work hourly based, and that's what I did initially. Initially, I was an hourly employee, so my schedule was super flexible. I think to answer your original question, at the time uh, when I started, I had been homeschooling, and I just realized I wasn't going to be able to homeschool once I started because the program is a full time Monday through Friday. It's like a 20-hour work day. So I mean, workload. I think we had school for the most part from 8 to 4, or sometimes 8 to 3, depending on if we had labs that day. So
Okay.
it is definitely, I think it would be really challenging to go to school and work on the side. Matter of fact, I had some classmates who initially started with a job, and then they didn't even have kids. So they were single, they had a job on the side, and they ended up kind of quitting their jobs because they realized they just couldn't handle the studying and the workload. And so
Gotcha. And so, how technical is it? Like, you have to take anatomy classes. What kind of classes do you take over these 4 semesters?
right. So yes, you're taking your anatomy and physiology. You have a physics class you take. So you have some general courses, kind of like you would with any other program. I had a math class, I had an English class, I had a psychology class, physics, but those were just kind of like your basics, your core classes. And then the focus of the program was, anatomy and physiology, kinesiology. We had a neuro class, and then your classes on rehabilitation, just like learning how to help people transfer, how to help wheelchair bound people, how to help people with prosthetics, because we do
Mm.
see all of that. We treat people, and now I will say this, we treat people that have had brain injuries, we treat people who have had strokes, yes, who have lost a limb, and we're helping them learn how to walk on a prosthesis. So it's can be a wide spectrum, of course, within the field too. There are different tracks as well, which when you're going through the program, you at the end, just like most medical programs, you have clinicals at the end of your session, or at the end of your schooling. And we had 3 rotations of clinicals. So each rotation was in a different clinical
Yeah.
setting. Um, so, your clinical settings could be outpatient, your clinical setting might be acute care, which is in a hospital setting. It might be in a long-term care setting, like a nursing home, or it might be in like a rehab center where people come after surgery, but they need extra care, and so they're in an inpatient facility, but just for a short period of time while they recover from whatever their injury was.
And what did you feel like were the pros and cons of each of these different clinical settings? Like, for instance, a
Well,
long-term care facility. What would what the pros and cons be to working in one of those situations?
so the each setting, of course, you're working predominantly with a certain clientele or a certain patient population. So I would say that what I liked about having to be, so it was mandated, we couldn't only work in one setting. Even if I said, I came into class like, I know I want to work in a nursing home, I know I want to work with more elderly patients, but you had to try all these settings. And I think that was really good because it helped people have exposure to things that maybe they hadn't considered, and maybe that what they thought they would want to do, they realized, this isn't really, I really don't enjoy this as much. So it kind of helps you, weed out your preferences too. But so the pros would be like, so for instance, if you are working in acute care, these are people who you think about, you've just had heart surgery. I mean, you think about, you go to visit somebody in the hospital and the PT comes by, and what do they do? They're pretty much getting them up, making sure they can use the bathroom. They're making sure they can if they have any tubing or drain tubes, attached to them, if they have any monitoring attached to them, catheters, you're managing and helping them to manage that. And the goal being to help them learn how to get up in bed, how to go to the bathroom, how to, helping them start walking again. So acute care is typically, you're not doing a lot of varied, your exercises isn't super varied typically, because you're dealing with people who are much more deconditioned at that time, and the main goal is to just make sure that they can go about just their very more basic daily needs. But so that a pro is, maybe you don't have to, there's a little less, you're kind of doing more of the same thing with each patient. If that's something, it's a little bit less you're not having to customize everything to everybody, everybody, you're kind of work with the same thing. But, on the same time, if you're not a person who's super comfortable with, you're seeing someone with all these tubes coming out of them and managing that, then that's might be something. And you have to also know a lot more about medications. And so it's just that more hospital like setting where you've got to kind of be monitoring their blood pressure, making sure that their oxygen's, their vitals are in a stable and therapeutic realms. So there's a little bit more of that kind of emergent knowledge, that you are going to be dealing with. In some other settings, what I would say, that you're not doing like high level exercises with them. And so what I like about then you have a nursing care setting. Again, you're going to predominantly deal with a certain age group. You know, you're not going to have like 25, 26-year-olds typically in a rehab center or in a nursing care, you know, a nursing long-term care type facility. And again, it's going to be more functional based, but yet you'll still, so it's not as intense as like a hospital setting, but as far as having to manage catheters and things like that. But you, on the flip side, you're going to be doing, sometimes you come into a room and you're helping someone who has, you know, gotten to the bathroom on time. And so you're kind of helping them with the toileting situation. So you still have some people who are more ill, and there's going to be that and more of a there's a little bit more nursing care that goes on there. So I loved working with the older population. They're fun. It was great to kind of encourage them because sometimes they don't have a lot of family visit very often, and so just you have that opportunity to just be either, you know, bright face in the middle of the day. In an outpatient setting, you are dealing with everything. So what I liked about, for me, why I chose the outpatient setting was I wanted something where I could keep kind of all of my skill set to begin with. Um, and in that setting, you're dealing with people who are, you know, had shoulder surgery or had hip surgery. They may be an older person who is working on balance and they've just gotten deconditioned and they need strength. So you have all of the injuries. I have people from 20-year-old to one of my patients is 99 years old, and
Oh, wow.
her goal was to, yeah, she was 99 years old. I think it's either this week or next week, she was going to be having a birthday party. And her goal was she wanted to walk with her cane at her birthday party for her 99th birthday. So
Yeah, yeah, I love
yeah,
it.
so you've got
That's
all these,
great.
the pros and cons are really, I said the pros and cons I really think are based on what you personally as a person are like, what do I want to work with? I think there are, you know, I don't, in many ways, the cons are really just more of a personal preference than they are a necessary, like, I would,
Sure.
you know, that field, I wouldn't want to do that field. But, you know, for me, it was just more of, yeah, I don't want to work so much with all of the leads and all of the catheters and having to do all that. And I enjoy working with a more varied population.
And what about sports medicine PTA? Like, I guess that would be more younger
Oh,
people
yes.
and more joints.
Yes. Yeah. Yep. So we do also have, yeah, there's sports medicine is another avenue. Usually there are certain clinics. So like at least within Riverside, certain clinics have certain specialties too. So even though I work at outpatient, there are multiple outpatient clinics. One is kind of tends to work with more people with neurological issues. It could be like Parkinson's. It could be um, like a post brain injury, a stroke patient. And so they have more of a neuro rehab clinic setting, and some of the PTs they really specialize in that. Um, then we actually have a sports clinic. We have two of them in Riverside, and they really focus just on sports. So they're working with college athletes, high school athletes, mainly athletes in the area, or they might get referrals from maybe someone who is just a really competitive, you know, marathon runner or in a particular sport where they're highly competitive. And so they'll be kind of
Pickleball.
funneled into that. Oh, well, no, we get the pickleballers, but yes, we get lots of pickleballers. So,
Yeah, yeah. And it seems like, especially if you're working, more in the outpatient and sports medicine areas, it would be very, like, a lot of variety. But in everything, you really have to think on your feet, right?
yes. I mean, you kind of go in. The goal, you know, each day is you'll have an opportunity when you get there to see who you're going to have that day. And so normally I spend about a half hour, you know, chart reviewing, going through my And a lot of them I've seen before, and then some of them will be new. They would have just been recently evaluated by the physical therapist. And so I'm just going through the PT's notes, seeing why they're the reason that they're being seen by physical therapy. And then you just kind of make a plan from there. And as you, the nice thing is, as you know work with someone, you start to know, okay, so this is what this person is capable of, and this is where we need to kind of progress along to. And so you just kind of make a plan. But absolutely, there were days, here's my plan, and they walk in, and they're a back person who decided to, this is the classic, right after Christmas, everyone comes in, oh, my back pain's all flared up because they've been putting away all of their decorations and lifting and carrying things up to the attic, and so they're all flared up. So absolutely, there are days that people come in and, or something's happened. Sometimes just someone has walked in the door and they had a death in the family. And so that session, following that is just a little different. You just kind of, that day, I'm a little bit more of a listener. We're doing things. We're still exercising, but you know, it, there are times when, even though you're working predominantly on the physical elements of with my patients, there's always that psychological, mental, emotional piece. We are a whole person, so we can't separate that. And there are days that you need to be a little bit more sensitive towards that. And sometimes I feel like I'm just a listener that day.
So that actually ties in nicely. One of the things I always like to ask is like, what skills that you kind of developed as a homeschooler do you see as a homeschool mom? Do you see yourself using now on a daily basis to be able to help your patients?
Right. Well, anyone who's homeschooled more than one child knows that every child is different. And even if you only homeschooled one child, that child is not necessarily the way you learn. And so you're still having to tailor whatever program you're using to that particular student. And then as a mom, what we're all essentially teachers, right? So we're all um, helping kids try to grasp a concept, helping to having to encourage them when they feel like they just can't do something. But you also, what are what do homeschool moms have to do? They have to plan. They're picking out curriculum. They're trying to figure out. They're selecting a program for their homeschool that is best suited for their children and for their family. And that is also what you do as a PT. You have a human being in front of you, and even though it's a knee person and my last patient, they're both, uh, they both had their knee replaced. They have a completely different background. Their mental status might be different, and their actual any comorbidities they have, any other illnesses or any other conditions they have can play a role in their progress. And so you have to, yeah, I can't, just because one knee to another knee isn't always the same. So I can't treat everybody the same. I don't pull out the same exercises for everybody because everyone has some unique needs that they have, and you have to tailor it to them.
And it sounds
So,
like nowadays the difference between being a physical therapist and a physical therapy assistant is the assistant is actually a lot more hands on with the patients.
yes, it is actually. And I mean, honestly, I mean, there's been times where I've been like, well, you know, yes, a PT gets a little bit more money. But well, they probably make maybe 30,000. It kind of depends on where you're at in your setting, um, how much more they make a year. But they predominantly are doing the evaluations. So they see a patient when they first come in, they're using their diagnostic and their tools to determine what is the major problem. They're ruling out other things too. They're ruling out, neurological issues. They're ruling out, potential other problems like cancers by
Mm.
testing. Not that they can prove, like, oh, I know for a fact that someone has cancers, but by a cancer, but they are able to do with the testing that they do, they're able to to know, hey, whether or not the body's responding the way it should. And then certain responses can definitely lead to, hey, there's something serious going on here. We've got, something that's either outside of our realm or that needs to be looked at. And thankfully, we actually have caught things that the other medical professionals had missed, which is
Okay.
good for our patients. Yeah. Um, Not me personally, but I mean, in the
Yeah.
screening process. And then when I see things, I'm like, hey, something's not right here. I'm noticing this, and I'll kind of have the PT relook at something. And yeah, things have been, I'm like, these symptoms aren't lining up the way they should. And we had unfortunately, a patient that actually had developed cancer, and she didn't know it. The medical professionals didn't know it, and we were able to kind of redirect her and say, I think you need to get this relooked at.
Yeah. So do you find yourself at the end of a day, do you find yourself drained from having been with so many people during the day? Because, I mean, in a typical day, you probably work with 8, 10, 12 people. Or do you find yourself
Uh,
invigorated just because you got to help so many people?
it can be a little bit of both. It can be a little bit of both.
Sure, sure. Yeah, yeah.
Sometimes I have come home and I am just like, I really don't want to talk anymore. I can't take in any more information today. And that can be a challenge, especially if I've had patients, a day of patients who are either in a lot of pain, or they are just having a hard time grasping, how to use their body in a helpful way as opposed to a hurtful way. And then other times it is, it's like, wow, this was so exciting. I got to do this today. I saw this patient who has really been struggling, and she really connected some things and was able to figure out and I was able to help her or him find a way to begin to take control over um, their own pain and their own uh, some of their. Sorry, Ashley, you're gonna have to edit this out. um,
That's okay.
it's like I'm losing my train of thought here. Let me start over. It can be really exciting when you have a patient who has been felt powerless with either their pain or how to manage uh, their condition, and then you're able to give them some tools where they can enact change and realize that they're able actually to modify, and they're able to modulate what they're feeling in their body, and feel like they might be able to gain back some of that freedom that they had felt that they had lost in their day-to-day, functional activities. And that's really great.
That's
It's
just
really great to see
amazing.
someone who is kind of just more shut down. Like when you start off and they're just like, I don't think I'm ever going to get better. I've had this pain for years. This isn't, I haven't, I just kind of sit on the couch a lot. And then they start becoming more functional and more moving. And guess what? I walked a mile and a half today, and I am,
Oh my
and
gosh.
their whole countenance starts to change, when they come in. They're
Yeah.
not just that person who has that real flat effect. Their eyes are brighter. They feel they're wanting to go out and be with their friends, and they can do it longer. And feel more like they're, as they say, I feel more like myself again. And
Mm.
that is extremely encouraging to me as a therapist, and to see
Yeah,
that.
very rewarding. Yeah.
Yeah.
That's great. And then I always think physical therapy is a fabulous skill set for yourself and your family. Have you ended up being like your knowledge has ended up helping like your actual family or your parents or your kids or something?
I mean, of course, it's funny. I don't know how many times I'll be in a grocery store and someone's like, oh, what do you do? And it's like, I work in physical therapy. And the next question is like, so I've got this shoulder problem. And I'm like, oh, well, here's where we work.
Yeah.
Try this place
Yeah.
out. But yeah, no, absolutely. It has been helpful. And there's a couple of things that I have learned that very quickly turn things around if it's appropriate. So some training I've done. So yeah, I've helped my dad. My uncle was visiting from out of town, was having back pain, and we did like a little down and dirty 30-minute PT session with him, and it really helped him a lot. Yeah, I've had friends, who have just well, it's funny. We used to at the church I used to go to. There's a couple of us that worked in therapy or athletic training, and sometimes at church people are like, Leslie, this I got this spot, and I call my pastor like, hey, I'm borrowing your office space, and I do a little work on their shoulder or something. So it was just kind
Yeah,
of funny,
yeah.
but it's nice because you can kind of work on each other too. But absolutely, my daughter's in sports, and so I've just used helped her when she's gotten injured, and just kind of given her some things to do to strengthen and help prevent injury, and also yeah. But my typically my kids are like, Mom, can you work on me? So anyway,
Oh,
I
that's
do get
sweet. Yeah.
get some of that. Yeah, get some of that from family. So it's fun.
And then,
I enjoy it.
so you've been a PTA for how long now?
This is my fifth year. Yeah. This, this I'm going
Okay.
into my
And
yeah, going this is
I
halfway through my
guess
fifth year.
as you were learning and building confidence and like even first week on the actual job, like when you were first doing it, did you have apprehensions of like, oh my gosh, what have I gotten myself into?
Absolutely. I mean, I don't think there are, and there's still sometimes days where I'm just like, well, struggle with, oh my gosh, am I choosing the right thing? Is this the exercise, the prescription of exercises I gave, were they the right ones? And you're also constantly learning, and I learn from my patients, and I learn from just, more experience with something like, oh, this worked with this person when they had a similar situation, and let's see if it'll work over here with this other patient. I had one fellow PTA who had been doing it, practicing a little bit longer than me. And there's a quote he had. He goes, Leslie, you cannot practice experience. And I
Hmm.
was like, I have to keep that in mind. Yes, the only way to gain experience is by doing it. And so you can't just create it. You have to go through the years and the hours. And as you gain hours, you get more confident, and you get more knowledge base. One thing I love about pretty much most of the places I've worked is also my relationship with my coworkers. I have good relationship with my coworkers, and I'm very quick. I've always been a person that's like, hey, if I'm not sure, I'm gonna, I don't necessarily try to pretend I know. I'll say, hey, I'm not sure about this. Can you give me some ideas on this? Or is my thinking on this correct? And so we'll bounce ideas off each other all the time. And we
Mm.
practice on each other too. So like if I'm wanting to try something, I always like to practice on a fellow, like I'm working on someone, and before I work on a patient, I'll work on each other, because I know what it should feel like, whereas, my patient might not. So I'll work on a fellow clinician and say, okay, I'm going to do this with you. Make sure you're feeling this the way I want you to feel it. And that's, again, that builds confidence. That's helpful. But I think that just to speak to that, that's where I think it's really important where you work. Thankfully, I've worked in clinics where we have really good relationships with the PTs. It's very collaborative. I haven't ever been made to feel like that I'm, less than because I don't have the PT knowledge. So, but yet you have a lot as a PTA. You are doing most of the treatments, the day to day working with patients, progressing their exercises, helping them gain range of motion, giving them skills and the better mechanics for how to move in their jobs, and do the things they have to do day to day in a way that is helpful and restorative to their body, as opposed to enacting more damage. And so, yeah,
And it sounds like that collaborative environment is a lot like being a homeschool mom in a community or a co op or whatever. So that's a
yeah,
natural transition too.
yes, yes. And then, I think homeschool moms are also people who tend to just, they ask questions. They're inquisitive, they're curious, and they're doing something, maybe a little bit. They're a little bit more outside of the box thinkers,
Mm-hmm.
and so I think. all of that is an asset. And I would say this too. I mean, a lot of they're observers. They're
Hmm.
natural observers where they look at something and they analyze it, and the homeschool moms I've been around, even just, taking an interest in things of nature and seeing something in nature, seeing something that's going on, and they're like, why is that different here than there? Why is that not the same? One of these things is not like another. And why is that? Well, that curiosity, that inquisitiveness, and then that problem solving of it and trying to figure it out, maybe going someplace to research it, is absolutely so beneficial in my field. It is not something that can be taught. And matter of fact, I see people. I think that's what makes the difference between a really good clinician and maybe an average clinician, is that one who really looks at something and it tries to kind of pull it apart a little bit. And the body is so connected. So, being able to just see that one area may present as the problem, but the source is actually coming from a different area.
Mm.
And when you begin to kind of connect those dots, that's when you can really help people and see progress and change pretty quickly.
Yeah.
Um, and that is not always. Some people, it's really interesting. Just they actually, I don't know if you saw this, Ashley, but heart surgeons, they were having them do nature study because they found that uh, looking at, and just, how with nature study, you're like to draw what you see and draw it with as much detail. Well, there were surgeons who were having a hard time seeing a good heart and a bad heart and seeing the difference between the two, and they actually were doing like a nature study and it was making them better surgeons because their facilities of observation and really seeing differences kind of came out in that. and
Yeah.
and
Yeah,
so it's just kind
exactly.
of.
And the way that we homeschool our children, like, again, I think people go into a new career, start thinking about it, and there's, trepidation, like, my resume doesn't look awesome, but there's so many skills that we develop, over time with our children and with other people's children, and and just even running a homeschool co-op, and the collaboration that is a soft skill that ends up being really like the thing that differentiates you as, in practice on a day-to-day basis with your patients.
Yeah, absolutely, absolutely. And
Well,
then I think you just wear a lot of hats as a homeschool mom too. And so and then you have that, and there's that flexibility piece too. I think a lot of homeschool moms tend to be, they're a little bit, they're flexible. They have to shift with whatever's going on. And kind of, you know, okay, we're gonna take a little moment, we're gonna regroup, and we're gonna kind of look at this in a different way and
right,
start
right,
over. And we all need those reset moments.
right, right.
So
Yeah. Now, just going back, would you say that what kind of field of homeschool did you guys fall into? More Charlotte Mason or classical?
it was kind of more of that, yeah, more Charlotte Mason is what we practiced predominantly. Yeah, I would. We did a lot of like I said, we did nature studies. I did use. Can you hear me, Ashley?
Yeah, I can hear you.
I We did use some other curriculum for like math. I kind of mainly used Right Start Math, which is still kind of a Charlotte Mason based program, but
Yeah.
that was probably, yeah.
Yeah, and so it all builds, and God uses all of it from homeschooling in the rest of your life, right?
He definitely does. And then that's the other thing. It's like I feel like it's day to day. I mean, as a homeschool mom too, it's just, sometimes it's like, Lord, what do I do today? What do I do with this situation? And there are often times too at work where I have a patient coming in, and or even in the moment, it's just that little quick prayer out. Okay, Lord, help me with this patient today because I can tell that they're struggling today. So give me the patience I need, or give me just the wisdom into to know how to talk with them and how to encourage them today.
Yeah. Yeah, exactly. And that's something that you've practiced for over a decade, right? By the time you go to a new career. So,
Yes.
Yep. All right. Well, thank you
Yeah.
so much. We appreciate all of your wisdom, sharing your story with us. And I just want to remind everyone to like and subscribe and share this with your friends, especially so that you can shine on.
Thank you, Ashley. Thank you for inviting me today.